Hello everyone, it's Angelica Sagath at the Osteopathy and Healing Center. So this video is the second video, a continuation of the previous video. We talked last time about prevention, how osteopathy helps with prevention. This video is going to focus on how osteopathy helps with palliative work, and we'll get into what that means as well. So before we go into that, just a little recap. Last time we talked about preventative measures, and what I mean by that is when people come in and that they feel there's no symptoms, they feel no pain, they feel no discomfort, that is called asymptomatic. And so when the patient comes in for an osteopathic manual therapy adjustment, they feel asymptomatic. It is preventative, okay? We prevent future symptoms from occurring in the future. An example would be seeing babies. Now, if somebody comes into the office and they say to me, I don't feel better after that treatment we had last time, and they're like, what's wrong with your treatment? Well, when I hear those words, I'm thinking that the patient is looking for more of a palliative approach, or a palliative treatment, and that's what we're talking about today. So they're looking for something that may make them feel good, that may make them feel better. But feeling better is not always being better. Okay, so I'm going to repeat that. Feeling better is not always being better. So let me explain myself more. If a person has had, well, we call them osteopathic lesions, or simply put, imbalances within the body, and it's chronic, so it's been happening for a long time, one treatment is not going to make that person feel relief, which is different than symptomatic care, which is palliative work. Okay, so that patient may need to come in for 10 to 20 visits, and they may need to be spaced out over 6 months to a year or more. And there may be times when that person feels worse for a while before they start to feel better. So when we're talking about palliative work, the person may be looking for a treatment to look to feel good, but structurally and pathologically, they're not fixed, they're not well, they're not balanced. An example of this would then be, for instance, elderly, or those who have had the structure in their body, the anatomy altered, such as fusions of the disc. People who had surgeries, rods put in the spine, for example. People who have had surgeries, yes, that have not been successful, or even if the person didn't have a surgery but they were born with what's termed an anatomical anomaly, or something is not structurally sound within the body, it has not developed properly, for example, like a sacralization, where their lowest lumbar vertebrae is fused to their sacrum. So now when we're talking about these kind of examples, they may not necessarily be able to be fixed. They may not be able to reach the state of health where they're feeling 100% anymore. Over a course of treatments, they may feel better. And again, they may not feel better at first, or throughout the duration of sessions. They may get good days, they may get bad days, they may get good days, bad days again. It all depends on how the body responds. And that's what we're talking about when we're talking about the palliative patient, or osteopathy for palliative care. So when a patient walks into my office or the clinic and they're saying, your treatment was a failure, let's say, what that means to me is that they're not understanding the process of healing, or of the work, the treatment, the osteopathic treatment. Again, they may feel worse at first before they feel better, and I'm going to give you some more information about that. I'm going to give you an analogy. I give this to a lot of my patients. So think about, there's people working in a factory, okay? So you have the body as well that has a whole bunch of collection of workers, let's say, in cells and systems. Okay, so some workers may be working overtime, they may be working harder than other workers, okay? And then you have the other people who don't work as hard, okay, who are on workers' compensation, WSIB, some people might be familiar with that. And then the foreman comes in and he's checking things out, and he's seeing who's working harder, who's not working harder. And he understands the people who are working hard will need to rest now. They're going to need a break. And those who are not working hard but keep complaining and complaining need to work harder. So when we're treating osteopathically the body, okay, some of the tissues within the body are not doing work like they're supposed to. They're not supporting the framework of the body. And then you've got some muscles as well who are working extra hard to support the body and hold the body up. So in this case, most often the muscles that are working really hard is the place where patients will feel pain or discomfort. So what happens is you get pain in the area, and that's a sign to your body something is wrong. And so when an osteopath comes in and starts rebalancing the muscles, okay, so you muscles over there, you worked hard, we're going to take off the tension. We're going to give you a little break. We're going to let you rest. And the muscles that were slacking off, or not supporting that body framework, are going to be made to work now to support the body as they're supposed to. So at that time, when the healing is occurring like that, the patient may feel discomfort on the opposite side of where they were feeling the pain, because now these other muscles need to start working. So they're going to feel that. They're going to feel the adjustment occurring, the change occurring within the body. It's part of the rebalancing of the whole body and the system. So sometimes when a person comes in for a treatment, they may feel great. Other times they may not feel that well. And that is a normal process of the healing process as the body rebalances itself. Now, regardless of what problem a patient may come in with, I always tell my patients, give yourself at least 5 sessions and see if you feel a difference. And the key word there is a difference or a change, okay? Because it takes time for the body to rebalance and heal. You may have some of those bad days or more of bad days before you start feeling better. There may be a lot of things, especially here if we're talking about the chronic patient who has had these problems for a long time. There may be a lot of things that need to be rebalanced before you feel symptom-free, which would be prevention. You would then continue with osteopathy. Okay, so Now, let's say the patient comes in and they're saying, I feel worse. And then I would say to the patient, where? Where do you feel worse? Is it the same place? And oftentimes it's not. The pain can move, can shift, and this is a good sign. When the pattern is changing within the body, you may feel shifts and discomforts elsewhere in the body, and that is normal. That's okay. Again, part of the healing, rebalancing process of the body. Another good reflection to think about when you're getting osteopathy treatments is when you're doing work, do you need to do more work in order to feel the pain you used to feel? And if the patient says yes, that's a good thing, because the body was able to now adapt enough so that when they put more load onto the body, they did not feel the pain. Okay, so the body can take on more stress, forces, and load on the body. Now, if you, let's say, go when it's winter now, right, and you're going to go and you're going to shovel snow and you're going to shovel, you're going to feel, let's say, the back pain come back on because you are overloading the body a lot within a small amount of time. So be careful, because if you're feeling symptom-free and you think that I can go and just shovel, I'll be okay, sometimes no, you won't be okay. So in those cases, I say, take it easy, take it slow. Whatever you're doing, try to break it up or have someone help you. So ultimately, we want the patient to work harder in order to hurt before they hurt themselves. The other analogy that I like to give, which is in the things to remember after your treatment, is think about an onion that you're peeling the layers off, layer by layer by layer. When you're coming into the treatment, we're peeling away those different layers, those different imbalances and lesions within the body. The longer you have the problem, the more layers there is to peel off. The more factors there are that are affecting your body. So here I would say just be patient with yourself and your body, because remember that one of the principles of osteopathy is your body is able to heal, and it will heal as long as you give it rest, the environment it needs, the nutrition it needs. It will heal. Okay, so I will mention here, so talking about those levels or layers of the onion, those factors playing a role on how we feel physically, how our body manifests things physically. Another layer is considering the emotions. You cannot ignore the emotions. Remember, mind, body, spirit are one, interconnected. So you need to look in your life as well at the emotional aspect. What happened when I had that injury? What triggers that injury? What's the emotions that are playing here? I'm not saying that in every situation this is the case, but most of them, yes, it is. So when a patient comes in for treatment, they may revisit those kind of emotions, and that's all part of the healing process. They may need to relive that experience that they had when they were younger, for example, in order for the body to totally heal. So now, let's say the patient comes in, and so we were talking about palliative care today. So let's say a patient comes in and they're like, I have pain right there and I don't want you to touch any other place of my body, but just treat this area. Well, I'm sorry, but when you come in for an osteopathic adjustment, we can't just touch that area and treat that area. The body is a dynamic unit of function. We're gonna, even if I focused on this area, it may affect your neck, your jaw, okay? So there's no guarantee that if I just look at one area, that wouldn't be osteopathic anyway. But if I was to do that, because of all of the relationships and connections throughout the body, it's going to affect other places within the body. So when the patient comes in for a treatment, afterwards even they may feel those different changes, even though they may be slight. And some people might not even be aware of these changes, but there are changes that are occurring. So again, that person who would say, I just want you to treat my elbow, I don't want you to treat anything else, that would be a patient who's looking more for palliative care, which osteopathy can treat. It could be palliative, it could be preventative, and the other thing that we'll talk about next time is that osteopathy can also be curative. So if I don't see you till the end of the year, I just want to wish you a happy holiday, Merry Christmas, Happy New Year, and I hope this information has helped you, or maybe has made you aware of some things, or be able to think more about how your body is being affected through the osteopathy treatments that you're getting. So I hope you enjoyed that, and take care for now. Bye-bye.